guys, in this lesson we are going to be talking about vomiting as a symptom of illness in our pediatric patients. Now I know you already know a lot about vomiting as it happens in our adult patients, and there is quite a bit of overlap in our nursing care and what we need to be doing. So the point of this lesson isn't to repeat all of that. What I really want to do is just point out and highlight a few things that are going to be different for our pediatric patients. So we're just going to jump right in and start looking at possible causes of vomiting for kids. So the first and most common cause is going to be infection, and this is true for adults as well. It's usually going to be caused by a virus and sometimes some kind of bacteria, maybe from food poisoning or something. But one thing to note is that rotavirus is the most common cause of both vomiting and diarrhea in children. And this used to be the cause for a ton of hospital admissions that we would see because it can cause really severe dehydration and electrolyte abnormalities. But we actually have an immunization for rotavirus now, and we really are seeing a lot fewer admissions, which is awesome. Increased intracranial pressure can also cause vomiting. Again, this is true for adults as well, but anytime we're thinking about a child who maybe has a brain tumor or a child that has had a traumatic injury where they've had a head injury, we want to be thinking about those things that can increase intracranial pressure, which may lead to vomiting. Okay, next, our GI obstructions may lead to vomiting in kids, and there are a couple of diagnoses here that are specific to the pediatric population. And those two are pyloric stenosis and intussusception, and I'm just going to talk briefly about both of those. So pyloric stenosis is an obstruction in the upper GI system. And what you have is you've got the stomach here, and at the bottom of the stomach, you have the pyloric sphincter. And what's happening with pyloric stenosis is that pyloric sphincter becomes really strictured and narrowed. And what that means is that food cannot leave the stomach and enter into the small intestines. And when that happens, you have infants who are feeding, and that food is coming right back up in what we would call a projectile vomiting. And the reason for that, again, is the food just can't go down. It can't pass through the stomach. And this usually happens for infants who are 2 weeks old through to 7 weeks. So it's a pretty specific and small age range, but that's the age range that we would expect to see the diagnosis of pyloric stenosis. And again, it's related with that projectile vomiting. Okay, moving on to intussusception. So intussusception is a GI obstruction that can occur in the lower GI system. And we have a full lesson on this, so I want you just to take a look at that if you aren't actually sure what intussusception is, but just know it can cause an obstruction. And both of these are actually treated with surgery, so it's really important that we pick up on those symptoms that let us know that there's something wrong. And for projectile vomiting, that's a good sign that there's the upper GI obstruction. And for a lower GI obstruction, what we would be looking for is vomit that is green, which means it has bile in it. So green vomit or that projectile vomit are two things to be really aware of during your assessment of the vomiting child. Another thing to make sure you think about with children is the possibility of a foreign body causing a GI obstruction. You guys, kids do eat things that they shouldn't. I've actually seen an abdominal x-ray of a child that ate 6 bouncy balls, and obviously those were blocking their intestines. The kid thought they were candy. So they had a GI obstruction from something very random that you might not think about initially. And the last pediatric cause I want to tell you about is gastroesophageal reflux. Now, obviously, adults get reflux too, but it's a little bit different in our infants and kids because our infants with reflux are actually bringing stomach contents back up and out. And adults don't usually do that with reflux. So as healthcare professionals, we're going to call that reflux, but parents are probably going to refer to it as spitting up or throwing up. And most of the time, this isn't a problem. And most infants actually grow out of it as they start to sit up more and eat solid foods. So by 1 year of age, it's usually not a problem. But there are some pediatric patients that deal with long-term gastroesophageal reflux. And usually those are patients who have chronic illnesses. So these are our patients who maybe have cerebral palsy or Down syndrome or really any kind of neuromuscular issue. And these kids can have reflux that's so bad that they end up with frequent chest infections, they're losing weight, And so they can have a lot of problems. And so we'll talk about how we manage that in just a second, but just do keep in mind that there are patients who reflux can be a long-term problem for. Our assessment of a patient that's vomiting is really going to be focused on the three biggest complications that we see with it. And those are aspiration, fluid and electrolyte abnormalities, and metabolic alkalosis. So really, our assessment is going to start by assessing their level of consciousness. So any patient that has a lower level of consciousness is going to be at a really increased risk for aspirating and compromising their airway. So anytime we see a patient that isn't awake or alert, they are at a higher risk. And signs that a patient may have aspirated are coughing, shortness of breath, and maybe a really bad smelling breath. So once we've made sure a patient's airway isn't compromised, we really need to move on to find more about their fluid status. And so really we need to start asking some questions about their actual vomit. So we need to know what it looks like. We need to know how much is coming up. We need to know how often it's happening. And all of this information is really going to help us figure out how dehydrated they are or how at risk they are for being dehydrated. We have a whole lesson on dehydration for you, so definitely check that out for more on how to assess fluid status in our pediatric patients. The most common electrolyte imbalances to be on the lookout for with our vomiting kids is going to be low potassium or hypokalemia. And actually, guys, this is true for any patient that's losing a lot of fluid through their GI system. Okay, so the last thing here that we really want to be on the lookout for is metabolic alkalosis. Okay, so metabolic alkalosis can occur with excessive vomiting, and this is because hydrogen ions are being lost every single time the patient vomits up that acidic stomach content. And this creates a less acidic, more alkaline environment in the body. So you have an increased pH and an increased bicarb. Now, if this goes untreated, what can happen is the patient's going to become lethargic and confused. They're going to maybe experience some neuromuscular excitability, and they can even have seizures. So all of that's really important that we're paying attention to those symptoms because we need to treat that metabolic alkalosis if we see it. We have a whole lesson on ABGs if you need more information on acid-base imbalances like this one and how we treat them. Therapeutic management for our pediatric patients that are vomiting is really all about preventing or treating those complications we just talked about. So we're going to be starting with our ABCs. We're maintaining that airway and preventing aspiration. Remember, a patient with decreased level of consciousness is at a greater risk for aspirating. So it's best to lay that patient on their left side to help prevent that vomit from going into their airway. Next for management is making sure that we are keeping an eye on that fluid and electrolyte status. And if they are in need of fluids, we're going to rehydrate either with oral rehydration solution or with IV fluids. Now, I mentioned earlier that some kids can have a lot of problems because of having chronic reflux. And like I said, most of the time this is in patients who have chronic issues. And so what we need to do is really be assessing those patients who have reflux for frequent chest infections from aspirating. And if they are having those frequent chest infections, then they may be a candidate for a procedure called a Nissen fundoplication. And this procedure, what it does, you can see in the photo here, is that it reinforces the top of the stomach to stop that reflux from coming back up. And this is only used in cases of severe reflux that are associated with those frequent chest infections or also with poor feeding. And if there is poor feeding, you may also see that these patients have a G-tube placed at the same time. And I'm sure you'll come across this during your clinicals because it is a really common procedure for our patients who are living with chronic illnesses. Your priority nursing concepts for a pediatric patient who is vomiting are going to be gastrointestinal and liver metabolism, fluid and electrolyte imbalance, and nutrition. Okay, you guys, the first thing to remember about vomiting in children is that it isn't really all that different from vomiting in adults. Now, there are a couple of diagnoses that I want you to be aware of that are different in kids or unusual So we've got rotavirus, pyloric stenosis, intussusception, and that gastroesophageal reflux. Your primary complications to be on the lookout for in our PEDS patients is aspiration, fluid and electrolyte abnormalities, and then also metabolic alkalosis. Remember, our treatment of vomiting centers around these three complications, so we're helping to maintain that airway and we're providing fluids and electrolytes as needed. And then always keep in mind that kids who are chronically ill, they may have long-term issues dealing with chronic reflux. And these patients are at risk for losing weight and aspirating. So they may need a procedure called a Nissen fundoplication. So make sure we're monitoring their weight and just know that that procedure may be indicated to stop the reflux from happening altogether. Okay, guys, that's it for our lesson on vomiting in pediatric patients. Make sure you check out all the resources that we have attached to this lesson, as well as the lesson on dehydration in kids, and then the fluids and electrolyte course. All of those topics should be linking in with this information that we've covered on vomiting. Now go out and be your best self today, and happy nursing.